Welcome, everybody. I want to welcome you to the Resident and Family Support Council meeting. We have these meetings every the second and the fourth Tuesday of every month. And today's topic, we're actually going to be talking about legislation that has been passed this last session through a lot of wonderful awareness about the long-term care industry and the changes that need to happen. And our guest for talking about that is Katherine Owtroski, who is from the Illinois Department on Aging, and she is the legislative person who we work with, who helps make sure that we're staying aware of all the bills that are affecting the elders in the state of Illinois, as well as in long-term care. But before I begin, I just want to give a couple little reminders. These meetings, like I said, occur on the second and the fourth Tuesday of every month. If you would like to be invited to these meetings and receive the invitation into your own inbox, please don't hesitate to send me an email. I'll make sure I put my email address in the chat so you can get my email from there. And I also would like to, at this point, thank the Illinois Pioneer Coalition for allowing us to use their Zoom account so that we can have these meetings. We really do appreciate that. And they received an in-kind donation from someone who has been working with us to make sure that these meetings can continue as we have them happening every other week. And so just a reminder, these meetings are really to help provide information to empower people so that we can really make sure that we are doing the best that we can for ourselves and for those that we love as we're navigating this long-term care process and the long-term care system, which can be pretty overwhelming to people. So if you have any ideas on how to continue to help promote these meetings, please don't hesitate to reach out to me, because I really would love to be able to make sure that those that want these meetings are getting this information in their hands. With this topic today that we're talking about legislation, I do want to just recognize one of our work group members for this meeting, Carrie. Carrie works with Caregivers for Compromise, and she has a son who lives in a long-term care facility in Illinois, and she's done a lot of legislative work around a lot of some of these issues that we're going to be talking about today. And I just want to say thank you to Carrie publicly for all the work that she's been doing in regards to making sure that these changes sustain themselves in the state, so that we can have great care for those people that are living in long-term care facilities throughout Illinois. So at this point, I am going to now pass the ball over to Katherine. Katherine.
Hello.
Hi, Katherine.
Hi, everybody. How are you?
Wonderful. Thank you so much for joining us. We're really excited to hear about all the stuff that's been happening in
definitely. For sure. Thank you for having me. Thank you for letting me, join today's meeting and go through some legislation. So I'm going to start by giving a brief overview of the legislative process and how bills become laws. And then I'm going to go through a few pieces of legislation that we have been tracking and the Ombudsman's Office has been tracking throughout the legislative session this year. And I will be sure to link all of the bills so you can go on and read the language for yourself if you'd like to. I'll go ahead and put a link to them in the chat, and I'll also go ahead and put my email too if anybody has any follow-up questions or anything that I can help with legislatively. So, but to start, the legislative process, usually begins with a bill being drafted. Bill ideas can come from, a legislator themselves thinks, they have an idea for a law that they'd like to change, or a law that they'd like to introduce, a new law that they'd like to introduce, or maybe a law that they don't think is working and not serving the people of Illinois anymore, and they'd like to repeal it or change it. Sometimes ideas for legislation can come from stakeholder groups, like AARP or the Alzheimer's Association, or other types of groups that have, a vested interest in the well-being of Illinois residents. And sometimes ideas for legislation can come from constituents. Sometimes, a person can reach out to their legislator and say, I'm having this issue or I have this idea. And then they would go ahead and have some language drafted with the Legislative Reference Bureau. Once they have that language, they would go ahead and file it as a House bill or a Senate bill, depending on what chamber they're serving in, the legislator is serving in. And then it would be heard first in a committee. And then once it's heard in the committee and voted on, if it gets, if it passes committee, it'll make its way onto the House or Senate floor, and where it's voted on then, and then it repeats the process in the other chamber. And once it's been voted on in both the House and the Senate, then it's sent to the governor's desk for approval and is signed into law, usually. I do have a fun little link from the Legislative Research Unit, which has actually turned into, I think now it's called COGFA, but it used to be the Legislative Research Unit. And I will go ahead and put that in the chat too, in case anybody's interested in learning a little bit more about the legislative process. Now I will go into some of the legislation that we've been tracking. So I apologize. I probably should have done like a fun sort of like PowerPoint or something to kind of explain these different initiatives, but I'll do my best to elaborate with just my words, if that's okay. So the first bill I want to go over is House Bill 246, and this is the nursing home rate reform bill. This has been, a long time coming. We've had the House and Senate have had a lot of hearings about what's going on in long-term care facilities and how the state can assist in making sure that residents are receiving the care that they need, whether that's through, workforce retention, making sure that the staffing levels are appropriate, and other ways. So this rate reform legislation drives $700 million into Medicaid funding nursing homes, and it creates a new pay scale for nurses assistants, and it includes a few other changes that will hopefully benefit long-term care residents. The next bill I want to mention is the state budget. This year, there's a few exciting changes for the Department on Aging specifically. We have $14 million for home delivered meals, and then another $14 million towards rate increases for in-home care providers, and then an additional $4 million toward family caregiver services. It also includes about $10 million to hire additional nursing home and assisted living facility staff and epidemiologists at IDPH as part of our lessons learned from the COVID-19 pandemic. Another measure is Senate Bill 1405, and this just ensures that residents of a long-term care facility are not isolated. It ensures that long-term care residents and people in hospitals are able to have visitors even during a public health emergency. I know during COVID-19, a lot of people were not able to have visitors, and that really does take a great toll on somebody's well-being. So this legislation just takes a step to make sure that everybody is able to see their loved ones. Another piece of legislation is Senate Bill 1633. And what this does is just state that long-term care residents have the right to be treated with courtesy and respect for their individuality by employees of the facility. And it also requires facilities to implement and establish a written protocol for anybody who wants to file a grievance with the facility. And it also requires facilities to post information about the long-term care ombudsman program on the homepage of their website so that residents can more easily access that as well as their families. One more bill is Senate Bill 3490. This has to do with LGBTQ older adult advocacy. It creates the Illinois Commission on LGBTQ Aging. It implements a training and curriculum requirement for Department on Aging staff, as well as any entities that contract with and receive funding from the department. And it also establishes an LGBTQ older adult advocate within the department. One more bill, and then our second to last bill that I'm going to talk about, so that I'm not too long-winded, is Senate Bill 3707, and this just requires 2 hours of annual training for community care program providers on caring for those with dementia or with cognitive decline. And our community care program helps provide in-home care and other services for older adults. And then lastly, this is actually an initiative of our state long-term care ombudsman, Kelly Richards. It removes a requirement for the long-term care ombudsman consumer choice website to be labeled residents' right to know. Kelly and I felt that that might be misleading because the consumer choice website is really supposed to be a tool for residents and their families to find a facility that meets their needs, whether it's a facility that has memory care or a facility that has multilingual services or allows pets. And it's not so much about residents' rights, although, there are links to information on residents' rights on the website. And all of these bills are legislation that passed, luckily. It passed both chambers, and they will all shortly be on their way to the governor's desk for approval. So some exciting changes for the state and for anybody who's in a long-term care facility, as well as their family members. Like I said, I'm going to go ahead and put a link to all of these bills in the chat, as well as my email. So if you have any questions or would like to talk a little bit more about any of the bills that I mentioned or anything else, feel free to reach out to me directly.
Thank you so much, Katherine.
Of course, I'm sorry again that was so long-winded. I regret not putting together a PowerPoint.
Oh, that's okay. That's okay. And I'm glad you're going to put those links in there so that we can all have access to that. That will be really, really helpful for everybody. And just to start with that Senate bill, and I know you need to leave us at 3:30, so I'll be mindful about that. So you said that they're going to go to the governor's desk now for signing. And once that gets signed, then these bills go into they're enacted, and that's when people have to start following these bills. Is that the way that works?
Oops, sorry, I was muted. Yes, that's correct. Some of them have different effective dates. It depends on how it's noted in the legislation. Sometimes they have an immediate effective date. Sometimes they have a more specific effective date. And then if they don't have any effective date listed in the legislation, then it means that it would just be usually in most cases would be implemented on the first of the following year. So for example, if a piece of legislation passed this year and it was signed by the governor over the summer, but didn't have an effective date, it would go into effect on January 1st, 2023.
Okay, because I know one of the bills that's gotten a lot of buzz has been the first bill that you mentioned, that House Bill 246. And that because so much of the Medicaid funding, it's really affecting that for one of the first times in a while, that's being redesigned on how that Medicaid funding will look like for those that live in long-term care. And the fact that it's also putting some definitiveness to some of the staffing issues that we have seen through the pandemic as being one of the reasons why people were not getting the care, they weren't getting their needs met the way we all deserve to have our needs met as we enter into, when we live in long-term care. So do you have any idea when that is supposed to go into effect?
Let me check. I should know off the top of my head, but let me just look it up really quickly for you.
Okay.
That would be internet wonderful. Will allow.
Yeah. Because that's one of the things about that bill, just for everybody to be aware. And anyone, please feel free to jump in at any time. It really, it's the way everybody who lives that's on Medicaid, that lives in a nursing home, they get a amount of money for living in the nursing home. The nursing home then gets that money to help provide the care for the individual. And so this is the first time where they're really looking at it being driven by a system based upon an assessment that will look at your care needs to make sure that you're getting the care that you, so that you're getting paid for the care that you deserve to have. So it's it's very exciting that we're starting to see this. It's kind of matches up better to how Medicare pays for people to live in a long-term care facility. So it's doing a better matching up of that system that the federal government has been usually to pay for those that live in long-term care facilities. So.
Hey, Catherine, this is Matt Hartman with the Illinois Healthcare Association. I can answer that question because we worked with the Department of Healthcare and Family Services to pass this actually, and we're one of the chief proponents. So the bill, the new rate and tax methodology goes into place July 1st of this year, or upon final approval of the reform methodology and the tax methodology by federal CMS. But we have a lot of assurances from Director Eagleson that they believe federal CMS will get it done before that July 1st date. So it would be for dates of services beginning July 1st of 2022.
Thank you so much for that, Matt.
That's very helpful.
Yes.
Very welcome. If there's other questions about it, we're more than happy to answer them, because we're extremely excited that this is in place, because it means a lot for our residents and our staff.
Mm-hmm. Yeah, and that's definitely helpful, because we, as much as, the department is excited about this, we kind of just played a supporting role. We didn't, or not even a supporting role, we just kind of were able to watch this happen, as I know HFS and a lot of other stakeholders worked really well together to get this done. It was a totally agreed upon bill, and I'm sure Matt would be able to, expand much more than I would, but it's definitely something that's exciting and that we wanted to talk about today. And I really do appreciate that Matt is really the expert here and can contribute.
Yeah,
So
and I think that's a very enlightening thing that happened through the process of getting this bill passed, is that the providers and the state came together to really come up with something that does make sense for those who live in the long-term care facilities in our state. And the fact that it's also supporting staff at the same time. That's an important piece, because you can't provide the care if you don't have the staff. And to be able to provide a better support mechanism so that the facilities can support the staff is a really important piece of legislation that happened. So congratulations on that being passed. I know we were all very excited when we saw that happening. And I know those of you, yes.
I was going to say in the chat, somebody asked, what bill are you talking about right now? So I put in that it was House Bill 246. I just want to point out for people, if you're familiar with looking up legislation, if you type in House Bill 246 into the General Assembly's website, the short description is landscape architect. So it's important that you read down, because there were amendments filed, and that's where the piece related to the nursing home rate reform basically replaced everything from where this bill started. But just at first glance, every time I look up this bill, I think I have the wrong bill number. So I just wanted to point that out, is if you are looking at the General Assembly's website, make sure you scroll down to get to the section specifically that talks about the amendment that put rate reform in the law, or in the bill.
Yeah, definitely. Thank you, Jessica, for mentioning that, because I did have a note for myself to say that, and then just forgot to do so. So thank you so much, Jessica, for the reminder.
Now, do we know how this bill is going to be supporting that higher pay scale for CNAs? Do we have any idea on how that's going to be playing out?
Okay.
So I would defer to Matt if that's okay on that one.
Yeah, there's a direct wage. It's not all directly to CNAs, but a sizable chunk of it is. There's about $80 million that goes directly to CNA pay, and then there's another $290 to $300 million that directly correlates to staffing ratios. So it correlates to making sure that the staff you have align with the acuity needs of your resident. Of the 80 million that's direct pass-through money, and of that other 290 million, I'd be remiss if I didn't say that obviously a lot of that's going to go directly to staffing as well, because that's what those costs entail. It entails salary, wages, benefits, and the like. So of that 80 million though, that's direct pass-through, it's done based off of tenure, and it's off a sliding scale. It starts at $1.60 or $1.50 rather, and goes up to $6.50. It starts at 2 years. So if you have 2 years of tenure with, and I'm sorry, my dog, you probably hear him in the background whining, I apologize. He hangs out in the office with me. If you've been there for 2 years, you start at that $1.50, and then I believe it's a dollar increment for each year after that. So you can see as much as a $6.50 an hour increase in your wages, which is significant. And that's a piece we worked with both with SEIU and with HFS to come to terms on. So good money that's going directly to the pockets of caregivers, and we're happy about that. The other piece of it ties, as I noted, ties to the acuity level in your buildings, and it ties back to the STRIVE study, which is a nursing labor study that dictates what an expectation of direct care minutes and hours is for a given resident's acuity. and it ties dollars flowing based directly off of where you are on acuity. It starts out at 85%, works its way up to as high as 125%, and a facility sees that goes directly into the nursing component of their rate. So it's kind of a sliding scale, and it goes, oh, I think the high watermark on that is, I think the highest level is $13.85, and it starts at $9, so it's incremental.
So we do have a question in the chat. They want to know, is that an increase in wages or a premium pay?
It is an increase in wages. It's it goes directly to wage. There's actually another piece, and Katherine mentioned it in the budget and in the BIM. There was additional ARP dollars, or American Rescue Plan dollars, that are going towards the sector as well. And the vast majority of those dollars goes to direct employee compensation. That would be premium pay. That's not for wage, that's for premium pay.
Okay, thank you. Thank you, Matt. We really appreciate you being on this call to be able to assist us with this information.
You're very welcome.
Hey, Lee, can I jump in here for a second?
Absolutely, Carrie.
So just so everyone kind of understands what Matt means by acuity of level, not all skilled nursing facilities are licensed to do the same thing. Some skilled nursing facilities are licensed to do people on ventilators that have a trach. And obviously that would be an extremely high acuity, versus other facilities are not, and they're licensed to do G-tubes or ports, but they're not allowed to do the others. So when they talk about the acuity of care, it really depends on what does the resident need and what does their license allow them to do. And trust me, I learned this all the hard way.
Thank you, Carrie. I appreciate that. So the next bill then that we had that that you had gone over, Katherine, was the House Bill 900. And that was to hire the additional nursing home, assisted living facility staff, and epidemiologist. I'm sorry, that's a big word. Could you explain that to a little bit?
So this is actually just in the state budget, and it has many provisions in there, and it just has funds that go to these efforts. And I am not a budget expert, so I might not be the best person to kind of explain how all of those funds are kind of what's the word I'm looking for? How they're dispersed, I guess, or how like the mechanisms that would allow for the hiring of these additional staff persons. But that it is an appropriation in the budget for that purpose. But if anybody, I can always get in touch with Sarah Harris, who's our CFO at the department, and kind of ask her if she can help me, break things down a little bit. She's really the expert when it comes to the budget stuff. So I'm happy to get back to the group with a more in-depth analysis.
Thank you. Thank you. Yeah, because I know that there's a requirement now that the nursing facilities have to have a infection preventionist. And I'm wondering if that's the funding that's to assist with that happening. So I'm just curious if that's what that is. I don't know if anybody knows that or not. But I do know that that's something that the regulations are requiring for nursing facilities to have now to help with the things that we experienced through the pandemic, to make sure that we are staying on top of things in a better manner by having infection preventionists. Carrie, do you want to talk a little bit about 1680, that was Senate Bill 1680, I believe it was?
It's 1680, 1620. So that the visitation bill that Katherine mentioned, first of all, just so everyone understands, is for medical facilities. It also only goes into effect if the governor shuts down visitation. If the shutdown comes from CMS, that bill will have no effect whatsoever. There are still some flaws in it. And I have the word of Chris Boss, Representative Boss, and Charlie Myers both that we will go back next January and do some more amendments on that bill to make it more beneficial to all facilities in Illinois. But that bill, the most important thing people have to understand is the governor has to shut down visitation for that bill to have any effect. It does not affect CMS, which I don't think everyone understood that part of it as the bill made its way through.
There was also a federal bill regarding that as well. Do you know where that stood?
So our federal bill, which is HR 3733, is slowly working its way through Congress. We have not had a hearing yet. Hopefully, sometime in the near future, we're working with National Consumer Voice and Toby Edelman and the Long-Term Care Coalition and a few other places of trying to find another approach to get our bill to go forward. You know, we're not giving up, and we'll just keep fighting until we get it passed.
So does that bill look very similar to the state bill?
No, 3733 actually would guarantee every resident the right to 2 essential caregivers, up to 12 hours a day. And that would cover any Medicaid, Medicare facility. And then once it passed at a federal level, we would have to go back to each state. Some states have already passed it or passed language that is as strong, if not stronger. And we would have to go back to each state for state licensed facilities.
Was it put into the chat where people could go to find out who their representatives are so that they can reach out to the representatives if they have any, they want about supporting any bills in the future, and or just so that people know who their legislators are? Did that link get put into the?
I'll get that put in here in a second, Lee.
Great.
And then we had a question, what is CMS? And that's just the Center for Medicare and Medicaid Services. It's the Fed, basically.
Yeah, that's the oversight. So Centers for Medicare and Medicaid Services is the branch of the who oversee the nursing homes in the country. So they're the federal regulators for the nursing home, and they're the ones actually who oversee the Illinois Department of Public Health, who do the inspections into the facilities. So they're the ones who have written all those laws and those rules that the nursing homes need to follow. And then the state, then we also have the state and the federal rules, and that's when they come in to do an inspection or there's a complaint about a facility, they look at what those regulations say to see if there will be a citation against that facility or not, based upon what the regulations say. So that's that branch that does that entity that does that. So that's a good question. And I'm sorry, we do have a tendency in our long-term care world to use a lot of abbreviations. And so not everybody, and it's good that people call us out on that, because we get caught up in our lingo sometimes, and it does get, it can be confusing for people. So thank you for that question. Do we have any other questions in the chat?
We do not.
I wanted to draw attention as well to that Senate Bill 4024 that actually Kelly and Catherine did a lot of work around the Consumer Choice website. And just to talk about that for a minute. The Consumer Choice website, actually, this was mandated to happen through legislation several years ago. And I'm not exactly sure when it came into play originally, but what it did ask is that there was a website set up that consumers in Illinois could go to so that they would have the right to know about the different facilities, what type of care they provide, where they're located, how many beds they have, just a bunch of information about that facility so that people could make their care choices. And so that has been referred to as the Consumer Choice website. So because of this legislation, it can where the title of this, basically of this website, is now being given the freedom to be able to be changed, if I understand this correctly. Am I understanding this correctly?
Yes.
So go ahead, Katherine.
Sorry, go ahead, Jessica.
I was just going to say, so the original language in the law said that we had to have a link on our website that was titled Residents' Right to Know. And it's not very descriptive of what the purpose of this website actually is. And so because in the original language, they made it so specific, we actually had to go back to the legislature to get them to amend the law so that we didn't have to use that phrasing for the link and could use something that's better descriptive of what it really is.
So that makes a lot of sense for everyone, so that people can be able to understand what they can access on that website better. Did we put a link for that in the chat for people to be able to access that website?
Yes, I just dropped it in the chat. It is. I'm going to keep my opinions on the website to myself. How's that sound, Lee?
Yes, well, we are working on it. I do want people to know if you go to visit it, it is something that is in part of the what we would like to do as a state office. We've gotten some feedback on it, and we want to be able to make it a better site for people to be able to navigate so that it can become much more user friendly for everyone. So that's something that we want to do. So yes.
The information on that website is actually completed by facility staff directly. So there's a questionnaire that they have to fill out, and full transparency, initially when the website was launched, there were technical difficulties with people getting signed up, and their passwords there were just a lot of glitches. So it became burdensome for the facilities. And so we've worked with the IT staff to make it more of a seamless process. And if you go, you'll see that many facilities have filled it out. However, there's still a great number of facilities that haven't yet. And so we continue as ombudsman to encourage facilities to complete that. They're required to complete it. And so we try to encourage them to do that. So if you know of a facility that's not on there, it doesn't mean it disappeared. It means someone at that facility has not completed the registration and completed all of their information.
Yeah, and if you do look on that website and the facility that you know of is not listed, if whether your loved one lives there or you have a friend or you whatever, please tell them that they should get on there and make sure that they fill out that the form and they get their. It's a very easy process. Then once all they need to do is just submit it, we then review it and we accept it, and it gets put up there fairly quickly. So it's actually. It behooves facilities to do this, because if we're trying to point people in this direction to utilize this website, and you're going to look for a facility, let's say, for example, that provides respiratory care, and you go to do a search in your area for a facility that does that, and you're a facility who does provide respiratory care, but you didn't fill out that questionnaire and you're not on the site, you just put yourself behind those other facilities that did do that. So the individual won't consider you because they're not going to understand that you can provide that care. So this is something that we want to really strongly encourage facilities to do this. And they are being asked this at the onset, typically of when they have their annual inspection. They are being asked this by the surveyors. So that's another encouragement for this to happen. So anything else around the Consumer Choice website that anybody wanted to ask? Are there any other questions in the chat at this point, Stephen?
Well, yeah, we just had one pop up, but since we're on the subject of the Consumer Choice website, just so people know, a lot of times, you know, I welcome phone calls from family members and prospective nursing home residents, you know, just to call up and say, hey, do you know of any place that allows smoking or, you know, allows me to bring in my dog? And a lot of times I can give you a list of places that can do that. So, you know, your local ombudsman, we can't promote or put down a nursing home, but if you've got some specific wants, then you can give us a call and we can help you narrow down your list a little bit. So I just wanted to throw that out there. But then the question that we had was, let's see, I see Catherine put her email into the chat.
Thank you for that, Catherine.
Of course.
And we understand you may need to leave, so
Yeah,
thank you.
I have to hop off to get to another meeting, unfortunately. But please feel free to reach out to me. I put my email in the chat, so anybody, go ahead and give me an email if you have questions about legislation or anything else that I can be of assistance with. And I also see Mary had a question about in-home care or home health care. If you would like to send me an email or if you would like to give me a phone call, I'd be happy to, talk with you tomorrow about how we could go ahead and get something like that set up for you. Once you're, about remaining at home for in-home care. So I'll go ahead and put my phone number in the chat as well. But I also just wanted to say thank you to everybody for having me. And I know I apologize that I have to kind of cut this short and hop off. But again, please feel free to reach out to me anytime. I'm happy to answer any questions about, legislation or otherwise.
Thank you so much, Catherine. We truly appreciate it.
All right. Thanks, everyone.
Bye-bye.
Bye.
Thank you. Yeah, and so just to read Mary's question, it says, please address long-term care for people remaining at home. My husband is 86 and has Parkinson's. When his health deteriorates, I will need help taking care of him. How would I go about seeking a home health? It's jumping weird when I'm trying to scroll, sorry. How would I go about seeking a home health care person who could come once a week or something to assist us?
So there is a community care program, and I think, reaching out to Catherine she can help give you some information on that. If you go on the Department of Aging's website, Department of Aging does have services and care, home delivered meals, community care program, some caregiver services. And so if you get onto that website, you should be able to look, and it's simply easy just to, you could just Google the Illinois Department of Aging, and it should come up that way. It's fairly easy to do that because these are questions that we even get as long-term care ombudsmen, where we only work with people that live in facilities. We do get questions like this a lot because there is a goal by the state to want to try to keep people in their homes as long as they can. So there are some supportive services out there. There are some for different services, there's some financial need for some there isn't. The community care program can really kind of help work that out, and that typically they can help refer you to where you need to go. So that might be able to help you. And Karen put in, who also works with the Department of Aging, she put in to reach out to your area agency on aging, your local area agency on aging, and you can access that information on our on the Illinois Department of Aging's website as well. And they can be very, very helpful in helping to navigate this very complicated, what feels like a very, very complicated process as people are aging in our state.
Yeah, and another simple thing, maybe people don't know where their area agency on aging is. Of course, internet connection isn't really an issue for this group, but if you don't have a way to connect to the internet, know somebody who doesn't have a way to connect, don't know where the area agency is, go to your local senior center, because chances are they're connected to the area agency on aging and they can point you in the right direction.
Thanks very much for the help.
You're welcome.
You're welcome. That's what we're here for, Mary. That's what we're here for. And that's what we really want to try to do. So while we're, having this conversation, if anybody has any topics for future meetings, please don't hesitate to drop those in the chat as well, because I saved this chat and I can help access those topics that you might want to see happen for some of our future meetings. Any things that you have questions about or you want more information on as well. I wanted to just talk for a minute about Senate Bill 1633. That was a group of elders in the western suburb area that really came together to really help formulate what that bill was going to look like. And it was a very empowered group of community members, people aging in a community. Some of them had lived in long-term care. Some of them had loved ones in long-term care or very dear friends in long-term care. And they've come together and they have been working together to help create some legislation that would really make sure that the rights that people have were being listened to fully. So they drafted this piece of legislation. And one of the things that they did put into that piece of legislation is that facilities need to put information about the long-term care ombudsman program on the homepage of their website. So we do want to thank them for that, because we do find that people, sometimes it's a day late and a dollar short. They say, if I only knew about this ombudsman program, these people who could help advocate on behalf of me or my loved one, I wish I would have known about it sooner. So with having that on the home pages of facilities websites, that will help make sure. And we're not regulatory. As a reminder, the Ombudsman program is not a regulatory group. The Ombudsman program is a program where we advocate for what the resident themselves wants. It's not what we feel they want, it's what they want. And so having that information, many times it can help even help just a facility and a resident open up a conversation. Sometimes residents aren't sure if this is a right or not a right, so we can help clarify that for them and then help empower them to work with the facility to get their needs met. Alan, I did see that you would like to make a comment. You could go ahead and unmute yourself if you would like.
Thank you. Hi, I'm Alan. My name's Alan. I'm a resident at a skilled facility in the north suburbs of Chicago. And I had some questions and concerns. I have a friend who's living in what was previously called an intermediate care facility. And he has a strong case of neglect going on right now in the facility, and his family is trying to have him discharged and sent to another facility. And the facility is going to do a very hard time and not willing to cooperate with the ombudsman for the city we live in and also the resident's family. And is there any other alternatives? Is there anything way they could work around this and get the facility to cooperate with this? Or is anybody
So Alan, specifically what's happening is the individual is not getting assistance.
Taking care properly. He's lived there quite a long time. I used to be his roommate over there. I moved to another facility in the same town about 7 months ago. And since I left, his facility's gone downhill. It's one of the Smurf homes now. It used to be an ICF, but since it's changed, it's gone totally downhill. But it's really sad situation over there.
So Alan, I would encourage your friend to contact his ombudsman.
Yeah, she's working really close with her, and they're giving her a hard time too over there, and she's getting nowhere with them, and they've gone on for a few months now. But it's really frustrating.
Alan, you could give your friend my number, and again, I'll put my email address and my phone number in the chat. You can give him my information and we can see, we can have a private conversation about what's going on.
Yes.
We can see what it is that, how we can help empower him to get his care needs met. How does that sound?
Good, thank you. Yeah, there's a family member you'd be able to talk to. It's really up to date. I'm working really closely with her because we really want to get him out of there somewhere safer.
Yes, and everyone has the right to be able to, to leave one facility, move to another facility, even, be able to, if they want to look at a discharge plan to go home. Those are all things that an ombudsman can really help assist with.
Yes, and she's the one for the city I live in right now. Her name is Candace. You may know her. She's been on this chat the last time she was on the part of this chat, but
Yes.
and she's incredible. And she helped me out a lot when I was being discharged, and she's trying to help my friend out right now as much as she can. But
Yes, and we will definitely see what we can do to assist in making sure that your friend is being listened to. So thank you.
thanks so much.
Thank you for that.
Yeah.
Are there any other questions in the chat or anything? That you can see?
No.
Hi, everyone. This issue that you're speaking about right now, the involuntary discharges, is something that I'm working on behind the scenes. The facilities are not using it properly, and it is affecting not only the residents, but the family. Some facilities are holding on to the residents because of the lack of care, and they don't want them to go to another facility where that facility would now see that there was some neglect. So
Yeah.
I understand what Alan is saying, and there is a push for these involuntary discharges to be amended to fit the residents' rights, because as they are now and as the facilities are using it, Alan is correct, they are not doing the proper thing by the residents.
And we hear a lot about involuntary discharges, about both sides of it. People who are being discharged from a facility who don't want to be discharged, as well as people who want to leave a facility who are having difficulty having that happen. So we hear two sides of those individuals that want to leave and are struggling to be able to get out, and the individual who doesn't want to leave and they're being told they have to leave. And it does get very complicated, but it is something that the ombudsman can definitely get behind. And I'm sorry, and they can definitely get behind and assist in that process. So thank you, Veronica, for bringing that forward as well. Alan, did you have something else you wanted to say?
Yeah, I was forced out by the facility due to some medical health issues. And I lived at the same facility since 1988. It took quite a long time, I'm sure. But they gave me no choice. I had to move from an ICF to a skilled facility where I'm at right now.
Mm-hmm. And that can happen as if you're in.
That has to do with the SMRF thing, which they're not really even following the regulations for the SMRF program over at this facility.
Yeah. So a SMRF, for those of you who aren't aware, is a specialized mental health rehab facility, and it gets abbreviated as a SMRF. That's how people refer to it. So those are facilities that specialize with people that specialize with mental health. So there's skilled facilities that specialize with skilled nursing care. And so then there's also the specialized mental health rehab facilities that specialize with mental health needs. And those that have each of those needs, it's better to be in a facility that's more focused in towards those care. And what can happen, Alan, like you're describing, is when somebody who might have had mental health needs, when their medical needs start superseding their mental health needs, is when there can be a discharge that can be happening, so that needs can potentially get better met at another facility that specializes in skilled care needs. And so that's something that can feel very devastating, because you had your home, it was in one place, and now you're being moved to another home. And this is our homes. And I think that that's important that we understand that these are people's homes.
So Lee, if I could chime in on this, something that I see a lot of is facilities will send a person out and say, we can't take care of you anymore. And the resident or the family just says, okay. And they accept it, and they try to find a different place to move into. If your nursing home tells you that they can't take you back, or they can no longer take care of you, ask them for the paperwork. because you have a right, don't just say, okay, say, show me the discharge paperwork, because that is your right to have that paperwork saying that you are discharged. That's where the form to file an appeal for that discharge is on the discharge form. So I really encourage residents, when they've been told you can't come back, to ask for that paperwork.
And I think you bring a good point, Stephen, because we do come from a place where sometimes people tell us things and we just like, oh, okay. Like when it happens in a hospital, even sometimes you're being discharged from a hospital and they're saying the doctor says you need to go to a nursing home, and not even talking about home care services that the individual potentially could get, or what is their support mechanism like. And people just accept it and they do it. And we have to remember that, this is your life. And so that you do get to be empowered with this. Just because somebody says something doesn't mean that that's the way it has to be. And so that's a really important conversation to have when it comes to this discharge, is to make sure that you ask for those, that discharge, the involuntary discharge papers. And if you're confused by it, or you can't remember if it happens to you because you're not going through it now, and all of a sudden you're like, I know they talked about it, but I can't remember what it was that they told me to do, reach out to your ombudsman. And I'm telling you, this is something that your ombudsman very much will be able to help navigate this path with you and help support you while you're going through this, because it can feel extremely overwhelming when you're being told that you have to leave your home.
Yeah.
It's really important. Work with your ombudsman. That's why the ombudsman program exists, is to help people be able to navigate their care needs in a better manner, in a more empowered manner.
So Lee, let's see, who was it that posted? Karen Coffey just posted in the chat 25 common nursing home problems and how to resolve them. So I'd say useful resource for people who are going into long-term care. It's useful for ombudsman too.
That is, and I know we do have ombudsmen that attend these meetings, and I think a lot of times the information that we do discuss during these meetings can be very, very helpful for us as we're working with people that are going through specific issues. I want to remind everybody that these meetings that we do record these meetings, and then they do get put up onto our YouTube channel. So at any point, you might not be experiencing something right now, or you may, it may be a friend a couple of weeks from now, or a month, or a year from now. You can log on to, all you need to do is just get onto the Illinois, it's IL Ombudsman. Would be the access for that, for the YouTube. Maybe Stephen, you could stick the link in there.
They're up at the top of the chat.
Thank you. And so you can just get onto that YouTube page and you can watch any of these meetings. You can go fast through it. You can slow down. You can stop. You can do whatever you want to do. And really just be able to revisit this information at some point. Again, that's the purpose of these meetings, is we want to make sure that everybody feels empowered with information so that you can have your care needs can be met in a better manner, and you can feel better in control of your future and your path. I do want to, Alan, I do want to say that you did receive a kudos in the chat, that someone said you're doing great, Alan. So know that somebody you got a cheerleader here who's really standing behind you.
So
go ahead.
Oh, Lee, I was just going to say we're getting towards the end of the hour, and could you plug our next meeting?
Absolutely, I will. Our next meeting, we're going to be talking about sexual expression in long-term care. This is something that we hear about.
Stephen,
excuse me. Does somebody want to say something? So we want to make sure that everyone understands everyone's rights in regards to what that looks like. Just because you live in a long-term care facility doesn't mean that there are not, that sexual expression cannot exist, that does not exist. It can, and it should, and it, we're going to talk a little bit about this. We've got, we're bringing in a speaker to talk about it. And so we're looking forward to this conversation. And that will be next on the 28th of April at 3 o'clock. And like I said before, if you would like to get the invite sent directly to you, I have put my email into the chat box. Please go ahead and shoot me an email and I will get you on the invite list that we can see you at these meetings. We so much appreciate everybody being at these. And I'm going to go ahead and I'm going to pop up the poll really quickly. We use this information to be able to see what topics work well and what topics don't work well for people. So if you can go ahead and complete this for us, this would be great before you leave the meeting. And we just like to know where everybody's from as well. If you did not put your zip code into the chat, please put your zip code into the chat so that we can get, we can have that information. And also if you're listening to this with more than one person, put that in there as well so we can make sure that we're keeping track of our attendance. So I think at that point, I'm gonna go ahead and I'll be staying on. But I will go ahead and I will actually end the recording and then I will go ahead and I will just encourage you to please complete the poll. And then we'll go ahead and I'll end the poll as well. So thank you. I'm going to end the recording right now.
Thank you.
So Carrie posted in the chat that if you came in late